Definition: Frey syndrome is a postoperative phenomenon following salivary gland surgery and less commonly neck dissection, facelift procedures, and trauma that is characterized by gustatory sweating and flushing. History: Frey syndrome was first described by Lucy Frey in 1923 and was termed auriculotemporal syndrome. It describes sweating and flushing in the preauricular area in response to mastication or a salivary stimulus. Percentages: initially thought to be rare, it was later recognized as a common occurrence after salivary gland surgery, occurring in 4% to 62% of postparodectomy patients 6 to 18 months after surgery. Frey syndrome mechanism. The synkinetic mechanism for Frey syndrome is aberrant reinnervation of postganglionic parasympathetic neurons to nearby denervated sweat glands and cutaneous blood vessels. Consequently, this results in flushing and sweating in the sympathetically void skin in response to mastication and salivation. The previous sympathetic responses of sweating and flushing are now controlled by postganglionic parasympathetic fibers. A close guide to understand Frey syndrome mechanism. In picture A, we have normal innervation of the parotid gland by the postganglionic parasympathetic nerve fibers from the auriculotemporal nerve. Picture B, we have postoperative diagram depicting the regenerated postganglionic parasympathetic nerve fibers extending to the overlying cutaneous tissue. And last, we have picture C, postganglionic parasympathetic nerve fibers innervating the cutaneous sweat gland that results in gustatory sweating. Symptomatology. The symptoms of Frey syndrome can include flushing, sweating, burning, neuralgia, and itching. Generally, the symptoms are mild but can result in discomfort as well as social anxiety and avoidance. Application of medical thermography to the diagnosis of Frey syndrome. Patients were considered to have Frey syndrome if signs of gustatory sweating and localized skin flushing of the parotid region were present. In 4 patients who had undergone unilateral parotidectomy, gustatory sweating and facial flushing were present after gustatory stimulation, and the presence of Frey syndrome was confirmed with minor starch tests in all patients. Infrared thermography was then performed in the same area measured. The contralateral size serves as an internal control for each patient. Before gustatory stimulation, the isothermal pattern of the disease site and the non-operative site was similar. Stress thermography using Asialogo showed a cold spot at the operative site in all 4 patients with Frey syndrome. The contralateral non-operative site showed normal skin temperature distribution in all patients. Minor test was positive in all patients. Pros and cons. Analyzing the meta-analysis of the pros and cons of partial superficial parotidectomy versus superficial parotidectomy for the treatment of benign parotid neoplasms. Pros. Most of the therapies used are given via injection therapy or by topical application. Thermography is a non-invasive facile test that provides a qualitative visual analysis of the cutaneous capillary response following parotid surgery. Many techniques aim at accomplishing the incorporation and maintenance of a barrier between the underlying postganglionic parasympathetic nerve endings within the transacted parotid and the overlying cutaneous tissue, as increased skin flap thickness, local fascia or muscle flaps, and the use of a cellular dermal matrix or free fat grafts. Cons. It is mainly head and neck surgeons who see and treat this disorder. However, it is important for other clinicians to recognize what these unusual symptoms represent. Potential negative social and psychological implications of this condition can be significant. The treatment consists primarily of surgical removal. However, the appropriate extent remains a subject of debate. Report of a case. Introducing the case of a 6-month-old breastfed baby with no relevant medical history, whose parents brought her to hospital due to a repeated bright erythema around the temples within seconds to minutes of ingesting fruit puree. The erythema resolves spontaneously within a few minutes. The baby does not reject the food, and she does not show any other symptoms. We believe this is an important disorder to take into account since it generates additional tests and unnecessary visits to specialized departments, while it could be easily treated by general practitioners. Anamnesis. Since the patient is asymptomatic at the time of the examination, the doctor decided to perform a controlled provocation test in the office. In this way, it is verified how, within a few seconds of starting the intake, erythematous plaques appear, of a faint red color and with poorly selected limits, located in bilateral temporal region, being more evident on the right side. Diagnosis. Infants. In the infant, it's a benign and self-limiting condition. The recommended treatment is the correct information given to the parents to maintain an expectant attitude until its disappearance over time, avoiding additional tests. Children. The diagnosis in children is clinical and therefore complementary tests are not necessary. Adults. Complementary tests are necessary only in adults. In order to delimit the area, the minor or iodized starch test is performed. This consists of painting the modified area with iodine and mixing it with starch. The patient is given a cellular food that stimulates salivation and consequent sweating, which will make the iodine mix with the starch, giving us a dark violet color that emits the affected area. Conclusions. 1. Never perform a parotid biopsy before surgery. 2. Use the electric stimulator as much as possible neural to detect the facial nerve and its branches. 3. At the end of the surgery, leave a whole mobile drain. 4. Tell the patient that there is a percentage of recurrences in pleomorphic adenoma. 5. The incision should follow the atrial fold for better aesthetics.